Good day, everyone. Welcome to today's lecture on a topic that's both personal and empowering: sexual self-exploration. Intended learning outcomes. Describe the role of sexuality in the formation of the self, the sexual self. Relate the relevance of human sexuality in the development of the self. Perform tasks designed to enhance learning of these concepts. Let's start by acknowledging that discussions around our own sexuality can be challenging due to societal taboos. Today, we're breaking down those barriers and encouraging open conversation. What is sexuality? Sexuality is the quality or state of being sexual. Being sexual is a normal and natural part of the human experience. Human sexuality encompasses both physical and emotional aspects. It involves not only the biology of reproduction but also the complex interplay of emotions and relationships. In sexual relationship, everyone has the right to their own boundaries, and these should be communicated and respected. For intertwining strands of sexuality, sexual desire or attraction. To whom, or in some cases what, someone is attracted, physically and emotionally. Sexual activity or behavior. What a person does or likes to do sexually: intercourse, masturbation, oral sex, sexual fetishes. Sexual identity. How someone describes their sense of self as a sexual being, e.g. heterosexual, bisexual, lesbian, gay, homosexual. Sexual experience. Observations of other sexualities, education or training related to sexuality, experiences that may not have been consensual. What's the difference between sex and gender? Sex refers to the biological and physical attributes that distinguish male and female bodies. These attributes include reproductive organs, chromosomes, and secondary sexual characteristics such as facial hair or breast development. Gender is a complex interplay of roles, behaviors, expectations, and identities that society considers appropriate for men and women. It encompasses the social and cultural aspects associated with being masculine or feminine. Key differences: biological versus societal. Sex is primarily concerned with biological and physical attributes, whereas gender is a social and cultural construct that encompasses roles, behaviors, and expectations. Fixed versus fluid. Sex is often considered more fixed and stable, determined by biological factors. In contrast, gender can be fluid, allowing for a wide range of identities beyond the traditional male and female categories. Assignment versus identity. Sex is assigned at birth based on observable physical characteristics, while gender is a deeply personal sense of identity that may or may not align with the assigned sex. Gender identity is a deeply held sense of being male, female, or another gender. It's how individuals perceive themselves and what they call themselves. This internal understanding may or may not align with the sex assigned to them at birth. Gender identity is distinct from biological sex, which is based on physical characteristics such as anatomy and chromosome. Key points about gender identity include: personal and intrinsic. Gender identity is a personal and intrinsic aspect of a person's identity. It's about how individuals see themselves and how they want to be recognized and acknowledged in terms of gender. Not binary. Gender identity is not strictly confined to the binary categories of male or female. Some people identify as non-binary, genderqueer, gender fluid, or use other terms to describe their gender identity that goes beyond the traditional binary. Development and discovery. The development and discovery of one's gender identity can be a complex and evolving process. It often involves self-reflection, exploration, and an understanding of one's feelings and experiences related to gender. Expression and presentation. Gender identity is often expressed and presented through aspects such as clothing, grooming, behavior, and other cultural markers of gender. However, it's important to note that gender identity is not solely determined by external appearances. Sexual orientation refers to an individual's enduring emotional, romantic, or sexual attraction to others. It exists on a spectrum, and there is considerable diversity within this spectrum. Diversity of sexual orientations. Heterosexuality. The most commonly recognized sexual orientation is heterosexuality, where individuals are attracted to people of the opposite gender. Homosexuality. Homosexuality is characterized by emotional, romantic, or sexual attraction to people of the same gender. It is a natural and normal variation of human sexuality. Bisexuality. Bisexuality involves attraction to people of more than one gender. Individuals who identify as bisexual may be attracted to both men and women. Pansexuality. Pansexuality goes beyond the binary concept of gender and involves attraction to individuals regardless of their gender identity or expression. Asexuality. Asexuality is a sexual orientation where individuals may experience little or no sexual attraction to others. It's important to note that asexuality is a valid and legitimate orientation. Queer. The term queer is often used as an umbrella term to encompass a range of non-heteronormative sexual orientations and gender identities. What makes us sexual? These are the factors that influence our sexuality. Hormones. Both men and women produce estrogen and testosterone. Hormones play a significant role in influencing sexuality by affecting various physiological and psychological processes related to sexual development, desire, and behavior. The interplay of hormones is complex, involving multiple glands and feedback mechanisms. Testosterone, often considered the primary male sex hormone, plays a crucial role in stimulating sexual desire, libido, in both males and females. While testosterone is present in both sexes, it is at higher levels in males and is associated with increased sexual motivation. Female sexual desire and behavior can be influenced by the menstrual cycle. Fluctuations in estrogen and progesterone levels throughout the menstrual cycle may impact mood, libido, and receptivity to sexual activity. Estrogen decline with age in women, which slows growth of vaginal cells, could lead to wall thinning, dryness, and decreased sensitivity. Testosterone levels remain constant in aging women, which increase sexual desire. Aging decreases testosterone in men, which leads to decreased sexual desire and quality and quantity of erection. Ethnicity. Ethnicity can affect our sexual behaviors, frequency, attitudes, communications. African American men and women are okay with multipartners. White and Hispanic women likely involved in a variety of sexual behaviors. White women are more likely give and receive oral sex. Religion. In general, the more religious a person is, the more conservative their sexual attitudes and behavior. Less they have premarital intercourse. Less they engage in risky sexual behavior. Less they approve of oral sex. More guilt they experience about sexual behavior. The perspective that views sex as a divine gift is often rooted in religious or spiritual beliefs that regard human life, relationships, and the physical body as sacred. The intimacy shared in a sexual relationship is considered a sacred bond that goes beyond the physical realm, fostering a deeper connection between partners. Viewing sex as a divine gift often involves recognizing the sanctity of the human body. The physical body is considered a vessel for the expression of spiritual and emotional connections, and sexual intimacy is seen as a celebration of this sacred embodiment. Sex is the power to create life, and it is natural that there are specific guidelines on the use of this privilege. Sex used in a distorted form is the reason for the suffering of many families. The 4 stages of sexual response were first outlined by the researchers William H. Masters and Virginia E. Johnson in the 1960s. These stages describe the physiological and psychological changes that occur in the body during the sexual response cycle. The 4 stages are: excitement phase. This is the initial stage of sexual response and is characterized by feelings of arousal and anticipation. Blood flow to the genital organs increases, leading to physiological changes such as erection in males and lubrication in females. Heart rate and breathing may also quicken, and muscle tension can increase. Plateau phase. This stage involves a continuation of the changes that began in the excitement phase. Sexual tension continues to build, and the body reaches a high level of arousal. The physiological changes become more pronounced, and individuals may experience a sense of impending orgasm. In this phase, there is a further increase in blood flow to the genital organs. Orgasmic phase. This is the climax of the sexual response cycle and involves intense physical and psychological release. It is marked by rhythmic muscular contractions, particularly in the genital and pelvic region. In males, this is accompanied by ejaculation. Orgasm is often considered the most pleasurable part of the sexual experience and is associated with a peak of arousal. Resolution phase. This final stage is characterized by a return to the normal, unaroused state. Physiological changes that occurred during the earlier stages, such as genital vasocongestion, gradually subside. Heart rate, blood pressure, and breathing return to baseline levels. The body relaxes, and individuals may experience a sense of well-being and contentment. It's important to note that the sexual response cycle can vary among individuals and may be influenced by factors such as age, health, and psychological well-being. Additionally, some models include a fifth stage called the refractory period, which is a recovery phase that occurs in males after orgasm, during which further sexual stimulation may not lead to an immediate response. Masturbation. Masturbation is used to be feared as cause mental and physical problems. However, it is currently viewed promote healthy sexuality, which may decrease sexual tension and anxiety, an outlet for sexual fantasy, and allows a person to test their own body. Female masturbation. In female orgasm is felt 95% of her masturbatory attempts. May produce the most intense orgasms. Taboo for women. Vibrators or dildos may be used in female masturbation. Male masturbation. Male masturbates 3 times more than women. 48% of single men reportedly masturbate. Not all men feel comfortable masturbating or feel guilty after masturbating. That's the end of our lecture about sexual self. In conclusion, the concept of sexual self is multifaceted and involves a combination of self-awareness, communication, body positivity, cultural understanding, continual exploration, and seeking support when needed. It's a personal journey that evolves over time and contributes to the overall well-being and fulfillment of an individual.